Concepts of Oncology, a channel exclusively for learning about cancers. Subscribe for new videos every week. Local excision of rectal cancer. Rectal cancer is treated by rectal resection with total mesorectal excision. But, if there is early rectal cancer, can it be excised locally? Preserving rectal function and avoiding morbidities of surgery like disturbances in urinary, erectile, ejaculatory, defecatory functions. Main reason for total mesorectal excision is tumor growing deep with mesorectal deposits and lymph node metastasis. But, if tumor is early with only submucosa involvement and no apparent lymph nodes on imaging, then local excision of tumor may give a chance of cure with minimal morbidity. Various approaches are described. Park approach. Transanal approach where long anorectal retractors are used to create working space. Transcoccygeal. Crask approach. However, both had several problems like transanal approach using anorectal retractors has been associated with substantial margin positivity and tumor fragmentation. This has resulted in significantly higher local recurrence rates. Transcoccygeal approach was better for anterior tumors only with risk of presacral abscess. These problems were circumvented by a surgeon named Dr. Gerhard Buss. With help of Richard Wolf, Germany, he devised a system with single port, multiple channels with CO2 insufflation system and optical support for excising tumor transanally. Interestingly, this development was before time as it came before advent of laparoscopy. So which rectal cancers are appropriate for local excision? Since lymph nodes are spared in local excision, only primary is addressed. Rectal cancer cases appropriate for local excision are those with minimal risk of lymph node mets, small size to prevent fragmentation, shallow enough for feasibility of getting negative deep margin. Clear indications of local excision are less than 3 cm in size, involvement of less than 1/3 of circumference, within 10 cm of anal verge, well differentiated, mobile and polypoid, T1N0, low risk T2N0, without LVI and PNI. The preoperative workup for selection of cases for local excision includes clinical evaluation including digital rectal examination to assess mobility of mass, complete colonoscopy to rule out the presence of synchronous colonic lesions, rigid proctoscopy to locate the tumor along the circumference and to measure the distance of the upper and lower limits from the anal verge, endoscopic ultrasound, use, to assess the depth of invasion of the tumor in the rectal wall, pelvic MRI to detect potential lymph node metastases, chest and abdominal CT to rule out distant metastases, serum carcinoembryonic antigen assay. Once a patient is fit and appropriate for local excision, there are several options and techniques. However, difference is mainly in the design of platform available, like transanal minimally invasive surgery. It can be performed using variety of probes by different manufacturers like transanal endoscopic microsurgery, Richard Wolf, Germany. Transanal endoscopic operation, Karl Storz, Germany. 1 cm margin is taken and full thickness dissection is done till mesorectal fat. Wand is irrigated with povidone iodine and closed primarily. So what are the challenges with local excision? The assessment of perirectal lymph node status is the main challenge of local excision for rectal cancer. The risk of lymph node metastases 0 to 15% for T1 to 25% for T2 rectal cancers. So T1 tumors without obvious nodes on imaging may still have micromets. As a consequence, high-risk T1 and T2 patients have a significantly higher risk of recurrence after local excision alone than after radical surgery. During the last decade, a multimodal organ-preserving approach, including neoadjuvant CRT followed by LE, has been proposed in selected T1, 2 and 0 rectal cancer patients to avoid the postoperative morbidity and mortality associated with rectal resection and TME without affecting survival. This approach is gaining interest but has higher morbidity due to surgery on irradiated rectal wall like wand dehiscence leading to pelvic abscess, and inferior functional outcome. Concepts of Oncology, a channel exclusively for learning about cancers. Subscribe for new videos every week.